Well, welcome everyone. And this is the community conversation for the first one for this year for our Community Relation and Veterans Commission for La Mesa. We're very happy to kick it off with the Advancing Health Literacy Program. They reached out to our city to see if they could share with us what they're doing and how their goal of developing health literacy strategies to address disparities that are seen in underserved communities across San Diego can be strengthened, and we're one of the communities that they're reaching out to. So welcome all the Masons that are with us for this first community conversation. We will have more this year, one in April on disabilities and high school students and young adults. So we'll talk to you more about that later, and there'll be more to come later in the year. As I said, tonight's program is the Advanced Health Literacy Program. It's administered by a joint partnership between the City of Chula Vista and the UCSD's Center for Community Health. The program's objectives are to increase availability, accessibility, and use of COVID-19 public health information and services, to improve collaboration across stakeholders, and to increase the capacity of community-based organizations to provide evidence-based health literacy strategies. And some of that goes over my head, but they're going to tell us what all of that means tonight. It's funded by a grant from the Office of Minority Health, and here to lead the program are Reem Zubeidi and Sarah Vincenti, co-directors. So I'll turn it over to them. Thanks.
Thank you so much, Dennis, and thank you to everyone at La Mesa for having us here tonight. We're really happy to be here to speak with you about our program and about the goals we have, and really about the benefit that we hope to bring to the greater San Diego community. As Dennis said, I'm Sarah Vicente, and I am a co-director along with my fellow co-director, Reem Zubeidi. And we have Ruth and Asma here with us tonight as well as members of our team. And I'd like to say a special hello and good evening to Blanca Melendres, who is our executive director at this UC San Diego Center for Community Health. We're very happy to have everyone here, and we look forward to talking with each and every one of you in just a minute. But I'd love to pause and just give Blanca 1 minute to say hello, if you'd like.
Thank you so much, Reem, for this introduction. We're just very thankful for the opportunity to partner with the City of La Mesa and for us to have this conversation with you all. So we're looking forward to today's conversation. Thank you.
Thank you, Blanca. So what we'd like to start off by doing is just taking a quick minute we have a relatively small group, so I think we can take a minute and do a quick round robin to share who you are and your affiliation for being here. And then we'll move into the next section of our presentation. So how about I will toss it over to Alan, and we can just do this popcorn style. If you'll just do a quick introduction and then pass it to the next person.
Thank you, Sarah. In the habit of going first with an A for a first name. So I'm Alan Durden. I am a commissioner on the Communications and Veterans Committee, along with Dennis Sharp. And I'm here to learn and to help wherever I can help. So thank you for having me. Appreciate it.
Megan, you're the next on my side, so I'm going to pass it to you next.
Perfect. My name is Meg Howell. I'm the recreation supervisor that oversees the Community Relations and Veterans Commission. Really excited to hear everything that's going on tonight, and I know this is a series for you guys with a lot of different communities, so very excited to see where it goes. And I will go ahead and popcorn it over to Nancy Sierra.
Hi, I'm Nancy Sierra. I am with the La Mesa Community Relations and Veterans Commission.
Thank you, Nancy. I'm looking to see who is on here next on my screen. Dr. Aflalo.
Hi, good evening, everyone. My name is Susanna Flalo. I'm a family physician. I'm the medical director over at Alliance Health Clinic that serves minority communities, but especially refugee and asylum seeking families. And I'm not quite sure how I got to the table, but I'm willing to share. I serve the Southeast San Diego area, but obviously I branch out into La Mesa and Spring Valley and wherever the need is for people of color in terms of their health. So thank you for having me.
Misty, you're up next on my screen.
Hi, I'm Misty Thompson. I'm an analyst for the City of La Mesa, as well as the Executive Director of the La Mesa Park and Recreation Foundation. And I'll help to introduce.
That cut out at the end for me, so I'm not sure if that did that toss over to somebody.
Did she say me?
Did she say Ruth or Sue?
I'll go.
Sue, do you want to go ahead?
Sure. Hi, I'm Sue Richardson. I'm the Community Services Director for the City of La Mesa, and kind of the point person for the city to the project. Oh, sorry. Bianca, did you go yet? Blanca, sorry.
That's okay. I did. But I'm Blanca Melendres. I'm with the Center for Community Health at UC San Diego. And yeah, that's who I am. So I think, what about Ruth?
Everyone, my name is Ruth. I am currently working with the UCSD Refugee Health Unit as a community specialist. And I'll popcorn it to this. Well, sorry, where she went.
I put a couple of names in the chat, I think, who haven't gone yet.
Okay, let's go with Diana, sorry.
Diane, sorry. Can I just talk?
Yes, Diana, I'm sorry. Go ahead.
Sorry, that's okay.
We're having a technical
I'm trying to sort out my situation too. So I guess the question was, who am I? Sorry, I'm late. I'm working on another computer at the same time, so I was a little delayed. I'm just really over 25-year, 30-year resident of La Mesa. I've been involved with the PTA. I've been involved with, AYSO, National Little League, the Mount Helix PTA Council. So it's the council of all of the PTAs for the La Mesa Springs School District. It's been a while. My kids have graduated college already. Thank goodness. So I've gotten I used to not pay attention at all. Everything seemed to be fine. So let everything go. But it feels like everything's gone a bit crazy. And so I started paying attention because it feels like if we're not watching what's going on, things are going to happen that might not be in the best interest of for the people of La Mesa. And I think that's who the body's supposed to be serving. I don't know if that's what the topic was, or was it about COVID? Sorry.
No, just asking a quick hello and introduction. And it sounds like you are a very involved community member. So we're glad to have you here. We're going to spend a good amount of time today really talking through some discussion questions. So we look forward to hearing your perspective, Diane. Rich, we got a quick intro from you, and then we'll go to Glenna and Doug. And if anybody else after that hasn't, then we'll do a quick introduction.
Yeah, absolutely. Thank you. Rich Gann, I'm on the Community Relations and Veterans Commission, and my main focus on the commission is veterans. Thank you. I appreciate it.
Glenna, did you get a chance to say a welcome introduction?
Not yet. My name is Glenna Bloman. I've been a resident of La Mesa on and off for 30 years. I'm a member of the Kiwanis Club of La Mesa, very active with working with the youth, especially at Helix Charter School. And I'm also a commissioner, have been for several terms with the Communications and Relations and Veterans Commission. And I am currently working with the disabled portion of that.
Welcome. Thank you. And we have Doug and Jack and Perry just quickly said she can't speak at this time, but she is with the city of La Mesa. So I'm going to pass it to Doug and Jack, and then we will move into our presentation.
Yeah, good evening, Doug Capel. I'm on the Community Relations and Veterans Commission and representing the veterans sector. Thank you very much.
And Doug, we can't, oh, I'm sorry, Jack. Yes.
Hi, so Councilmember Jack Shu, and I'm just listening in and pretend I'm not here. I'm just listening in because I wanted to see how great this evening is going with this input that we're getting from so many citizens. Thank you.
Thank you for being here. Has anyone not had a chance to say hello and give us an introduction? Am I missing anybody? Okay. Well, thank you so much. The next thing we're going to do, as the Advancing Health Literacy Program is an Office of Minority Health funded grant, one very important aspect is to understand the population that we're interacting with, that we're reaching out to. So we have some poll questions specifically about race and ethnicity. We would ask that if you feel comfortable answering these questions, we have two. One is about you yourself and your own race and ethnicity, and then about the race or ethnicity of the constituents or population that you generally work with in whatever work that you do. There's no right or wrong answer. And if you do feel comfortable answering these, we appreciate it, but also understand if you don't, that's fine. But we are going to go ahead. Asma, do we have those polls ready to go? And we'll pop those up, and if we'll take just 1 minute to fill those out, that'd be very helpful. Sure. Multiple choice. And Asma just shared in the chat that if you select other as your option, feel comfortable sharing, that you are welcome to private message her your answers. We are compiling demographic data anonymously from all of our interactions and our community conversations.
And just if the questions are not clear, the first one is related to your race and ethnicity, and the second one is related to the communities that you serve.
All right, take another 10 seconds to make sure everyone's had a chance to do that. All right. Thank you all so much. And with that, I'm going to go ahead and pass it over to Reem, and she's going to dive into the program itself a bit, talking about health literacy. So Reem, I'm going to pass it to you.
Okay. Can you all hear me? Okay. I just have to have technical difficulties for these. Okay, thank you all for joining and for sharing a little bit about yourselves. So some of you may have attended our info session back in January, but I wanted to quickly introduce our program and sort of ground us in the reasons that we're doing this work. So this is the Advancing Health Literacy Program, which is funded by the Office of Minority Health and being implemented in partnership with several cities, including La Mesa and other partners across the county. This is a community-driven program. We're working on sort of the first phase of it, which is information gathering and understanding the priorities in our communities, getting feedback from community-based organizations and community members, and really trying to get into the details of what are the needs of the communities that we're working with. Where are the opportunities, challenges, successes, and gaps that need to be addressed as we move forward. And that's really the goal of today's event, and we'll also get into that shortly. So the program's focus is on addressing health disparities related to COVID and its effects on underserved communities in San Diego. And we know that these communities are disproportionately affected by the pandemic for many reasons. We have a heavy focus on communities of color in San Diego because we know that there are disparities in COVID health outcomes for these communities. And a lot of these disparities are rooted in systemic inequities across multiple social determinants of health. There are many barriers that sort of reduce access to effective public health education, which brings us to health literacy. So what is health literacy and why are we focused on it? Because, you know, even people who speak well and you know, have no, you know, speak the language well, have health literacy issues when they aren't familiar with medical terms or how their bodies work, for example. If they have to interpret statistics and evaluate risks and benefits that affect their health and safety, if they have health conditions that require complicated self-care, or if they're voting on an issue that affects their community's health and they're relying on unfamiliar technical information. So when we're talking about health literacy, we're not just talking about a person's ability to read and understand or their language skills. We're also referring to their ability to use that information in addition to understanding it. We're also talking about an individual's ability to make well-informed decisions versus appropriate ones. And we're also talking from the perspective that organizations have a responsibility to address health literacy because it's connected to health equity, which is the attainment of the highest level of health for everyone and can only be achieved when everyone has the opportunity to be as healthy as possible. So you can consider the impact that health literacy has, and I'm sure that many, if not everyone here, is working to address this in one way or another. And this kind of lays out what some of the impact of limited health literacy. There's a health system impact, where there could be distrust and misunderstanding of the system and providers. Communication barriers is another big one, and these can have serious consequences on people's health. There's also a health disparities impact, which serves to widen the gap that our communities see and makes the burden of chronic diseases even worse. Then these obviously have health outcomes, which we see in the data when we're talking to, for example, refugee communities or other communities that we're serving. And then, so we have our next poll question, which is focused on getting into the social determinants of health, the areas that you work in, and what social determinants of health you are addressing through your work. Here we have a graphic to sort of help illustrate some of the social determinants of health. And it shows really how they each are and how aspects like financial well-being impact health, as well as, spiritual connection, the environment, the growth environment that a person is surrounded by, employment satisfaction, all of these have a role and impact a person's health. So Esma, if you're able to put the poll question up, and this will just ask you which of these social determinants of health would you say are a focus area for your organization or in your work? You can refer.
I just want to hop in here, Reem, real quick. And for anybody who's on here as just a community member, I would say, which of these social determinants of health would you like for the city and the county of San Diego, for the broader community to be focused on?
Yes, thank you, Sarah. We'll just take a minute to answer that full question. Give another like 10 seconds for this. So thank you for filling that out. I think it gives a really great idea of sort of, that we're all sort of doing work in different areas, but it's really overlapping in terms of just looking for better health outcomes for our communities. So now I'm going to stop sharing. I'm happy to answer any questions that you may have about anything that we just went over, but we also want to get into the breakout rooms. So I'll just give a minute for, I want to see if we have any, sorry, go ahead, Sarah.
So with that kind of base understanding of health literacy, what we would love to do now is we're going to move into some breakout rooms, and we have some focus questions about thinking about both the challenges that you see that you're aware of, but also what resources you're aware of. What are those things kind of standing in the way of the best case scenario, and what are the things that are already there that we can work to build on? So what's going to happen is that you're going to be asked to join a breakout room. So if you would please do that in just a moment when we're there. We will spend, we'll spend about 40 minutes there in conversation. We'll talk with our group, and if it seems like conversations are kind of wrapping up, we can come back together a little bit sooner, as this is not a huge group. And then we will plan on sharing out as a group to hear what each of the individual discussions really focused on. But before we do that, I just want to check and see if anybody has any questions before we move into our breakout rooms. All right, Asma, if you wouldn't mind going ahead and sending us there. Thank you. Hello, everyone.
Hello.
All right. Wonderful. Welcome. So I am going to be facilitating this conversation, but really I'm going to do my best to be as quiet as humanly possible, because this is really a time for you all to share and to think about what these questions mean for you and what they bring up. This does not have to be a linear discussion. It's not like we have to do these specific things, but we should be moving forward, kind of thinking about how things intersect. So there are no right or wrong answers to any of this, just keeping that in mind. All right, I will ask for one of you all to serve as, I will be taking extensive notes, and hence I have a second monitor over here. So if I'm not looking at the screen, I'm not distracted by something else. But I would ask that one of you maybe take notes about the high level, just main thoughts, so that you can share it back out when we come back to our group, to the whole group. Do you have any brave soul willing to do that for me?
I'm holding back because I think I talk too much at the meetings.
Diane, actually, as our, I hate to say like token community member, if you would like to do that and be the one to share, that would be great. Because otherwise we have a staff, a commission chair, and a council member in the breakout room. So it'd be great if you would like to do that.
Okay, let me grab a pen.
So I also want to say very much that as La Mesa city employees, like having that role, you do have a very unique perspective, and it is important. Obviously, we want to hear from Diane, and I'm excited, but we want to hear from you guys too. I don't want you to feel like you're muting yourself.
No, I just think for the taking notes and giving our takeaway, should be a great person to do that.
I think that's perfect. Great. Okay, so
I think it's, by the way, I think it's a very interesting makeup of this small breakout room. And Jack, I don't think you can be the fly on the wall anymore. I think we need, because there's only 4 of us, you got to participate.
It's true. It's true.
But I think we have really interesting perspective, like if you're going to do a cross section of different kinds of things. So anyway, having said that.
No, I think it's perfect. I'm excited, Dennis. So our goal here is really to think about and identify the barriers and facilitators that are impacting community, that are impacting the organizations and the individuals within your community, your experiences that you've seen professionally, personally, all of those pieces. So I'm really excited that you all joined us here today. And the first thing that I really want to think about is what are the disparities or gaps that you see either in your organization, within the community, that you either are focused on addressing or would like to focus? What things do you see here that are gaps?
Should I raise my hand?
I think we're small enough. You can just shout it out.
So I don't know how current this is, though I think it's pretty current. But when I served on the Mount Helix PTA Council, I had a role of in charge of parent education. And so when I went into that role, I met with every PTA president from each of this Spring Valley La Mesa elementary schools and or a representative from each of the schools. And one of the things, actually, I think I sent out a survey first. And one of the things that came back to me was one of them felt like they were having a very difficult time reaching the Hispanic population and Spanish speaking families because no information was going out in Spanish through any, there were no PTAs they did not have any resources available to them to translate. So a lot of people trust PTAs because it's really about their kids. So, so that's one thing, is finding a way, perhaps through schools particularly, to get information translated and available to families through that system. Along those lines, I also met with an employee who was Spanish speaking, that was her primary language, was secondary English. And she was a counselor in a situation where she was the only Spanish speaking person in the entire front office. And so she had to keep getting called away from her job. And it was a big issue because these people needed help and they had nobody to turn to. So not having enough people who can assist them and bring them forward and providing them access. On top of that, they tend to be very poor people. I mean, not all Hispanics are, but in those areas. And so they don't necessarily have internet access. So a major, I'd say, setback for getting communications and information to them. And on top of that, from that person I spoke with at one school, and a friend of mine who was born in Mexico, they said, basically people who are raised there typically are not inclined to speak up for themselves or reach out to ask questions of systems.
I think kind of tagging along with that language barrier, because that definitely is something that I see a lot in the city of La Mesa. And, we actually ran a vaccine clinic, and it was one of the first events that we did a English and Spanish full marketing campaign in. And it turned out to be very successful for the particular census tract that we were targeting. But I think that in addition to the language barrier for accessing things is that we are getting such a large influx of immigrants coming into East County, and they just aren't familiar with the US healthcare system. We also have a lot of native US born people who have recently received healthcare through the Affordable Care Act, and they've never been educated in how to use it. I was very fortunate. I grew up that my father always had health insurance for us. So I had yearly physicals. I knew that if I was sick, I could go to a minute clinic or to urgent care, and that I didn't need to go to the ER. But for a recent immigrant, or for somebody who's never had health insurance in their life, that has never been taught how to do those things, they don't understand that. So it leads to these influxes of wait times in our emergency rooms, and people not getting really the care that they need, either preventative or even immediate care that they may need that could be addressed better with a primary care doctor or through, urgent care or even a nurse's clinic. Sometimes you don't even need to see the doctor. You just need to see someone for, a simple urinary tract infection or a sinus infection. And not having that knowledge, and then that knowledge, one, not being there for English speakers. There is no health insurance 101 training when you suddenly have insurance, but then double that by introducing somebody to the country, and not only do they not know how to use it, but there isn't even like an English guide that they can have translated for them into that to have access to that. And very few people realize that, there's real-time translators available when they go to the doctors. And so it's this huge barrier, and they get nervous to go or, to send an email in their native language. And they don't know that the big healthcare systems have translators there. 211 and the County of San Diego will have phone translators there, but we're not reaching them, and we're not giving that information to them so that they have access to those tools to prevent these high dollar or life-threatening situations that come up.
Yeah. Along with that, there's I think a large influx. It might be further East County of, I'm not sure, I can't remember where they're coming from but from the Middle East. So there are actually a lot of Arabic speaking people that are coming in. So there's another issue that I never had the experience with, but I know that notices were coming out through the high schools, just, being aware that you need to be helpful. So yeah, kind of tagging on to what you're saying, Megan, that is, and then developing trust, people who've had very difficult life experiences, helping them develop trust in the system that they're not familiar with.
And that seems to be the two of the themes here that, I'm not connected as closely as Megan, or Diane was with PTA. I do work with FEMA and I do special education mediation. So I come across all kinds of folks, but aren't in that front line of trying to share information about health literacy or COVID vaccines and things of that nature. But the two themes that I just heard is in listening to Diane and Megan are, one is the trust, and that is the person or persons that are communicating. So the persons that are actually communicating it, if they're not one of them or somebody that they already trust from that community, it could be that neighborhood, that community, that, could be different ways of looking at that. That is, if you want to communicate, one is who it is and having someone that they do trust, or at the very least, that person introducing the person and saying why you should trust the person that's sharing information, because they may not have the expertise to explain it, but they can be there to help bolster that this is a person you can trust and to translate something that they don't. And the other is the medium in which they are communicating through. Obviously in person being one, if you could get in front of a church or other gathering of people that are coming together often with a trusted person to even introduce or be there, that's a powerful way of doing it. Finding the ways that they do get information, because as you said, many are not connected to the internet, are not involved in that. Using the media that they use to get to hear information from a variety of sources. So, it seems to me those are thematic, but that seems to be what I would think. There's a huge distrust about the system. There was reasons for that, things that happened in the 60s and earlier to various of communities, minority communities that are out there and they're afraid to. Many are afraid to do things, and so you see these campaigns. I see people from those communities, or at least from those minority backgrounds, on TV and other ones trying to convince people why they should do it. And I'm sure that's effective to some degree, but I think it has to be like what you're doing. It has to be more localized. It has to be more community based, and it has to be coming from someone, or at least side by side with someone they trust. The healthcare physician, great, except for, as Megan said, many of them aren't even going to doctors, or haven't even accessed the healthcare system, and even, whether vaccines are free, so that they not even have to access the healthcare system. They can literally go to the drugstore, go to the mall or wherever they're doing it. So it's really the hump we seem to be needing to get over now to get a greater percentage vaccinated and get as far ahead of the virus and the spread as possible is that trust and communication. And the third theme is local. Trust, communication, local. And I know, can tell that's what you're trying to do, and you're trying to gather more information as to how can you do that in various communities. But that's my thoughts.
Thank you. I'm going to pause for a quick second. Hello, Vic. Welcome. We were just discussing the first focus question, which is what disparities or gaps are you either in your organization or personally focused on addressing, or do you see that need to be addressed? So we're just talking a little bit about that. If you have something you'd love to share, I'd love if you would maybe say hello and introduce yourself, and then we'd love to hear your thoughts.
Awesome. Thank you so much, Sarah. And thank you all for allowing me to be here and share in this discussion. My name is Vic Martin. I am a medically retired Navy mineman. I worked with underwater explosives for quite some time. And unfortunately, while forward deployed in the Arabian Gulf, I suffered an injury, and as a result was medically retired about 9 years ago. My struggles and my injuries are invisible. They are mental health related. I'm very open about my mental health struggles and about the challenges that I've sort of faced as a veteran coming out into the world with mental health issues. So I, for the last 8 years, have as the Director of Veteran Services for Shelter to Soldier, which is a nonprofit that provides psychiatric service dogs to combat veterans at no cost. And now I've recently resigned from that position, and now I'm moving into a new position as the Executive Director at Warrior Resource Project, where we are providing valuable resources, cars, for example, to veteran families who need it at no cost to them. So my work is really voluntary and focused on the military community. I'm involved in many discussions to discuss how to possibly change the process in which active duty military become veterans. That process is about 4 days right now. And as I'm sure a lot of you know, our boot camp process is about anywhere from 6 weeks to 8 weeks long. So quite a bit of training to get veterans to become active duty folks to become active duty, but very little time spent in transitioning them out. So that's sort of my role in the community. And I'm also a La Mesa resident, so I'm very grateful to be here and see this discussion going on. I'm only here to listen and provide, some sort of feedback or help in any way that I can, and support in any way that I'm able. So again, I'm very grateful for the opportunity to be here. Thank you, Sarah. And thank you, Megan, Jack, and Dennis, and Diane. I appreciate it. Thank you.
We're really
actually
glad to have you here. We're going to say like the same thing. I think that we said to everybody that your perspective, we hope that you're not just a fly on the wall. I'm looking at Jack now, and we'd love to hear a little bit more. So when we think about this, thinking about your own experiences, both in the organizations that you've worked with, but also personally, because when it comes down to it, everyone that we work with is an individual, and we have to figure out where they are and what we can do to meet them where they are. And Meg, I think I cut you off. I apologize.
Yeah, no, I was just going to say that, Vic's perspective of getting medically discharged, and I'm assume that through your disability rating that you utilize the VA as your healthcare provider. And that's something else that we're dealing with the language and immigrant disparity, is that El Cajon has the largest number of foreign translators emigrating in the US right now. And so many of them are fighting for some type of a benefit, and they don't know what they're entitled to. And so again, it comes down to that education and that information being available. And then the language barrier of, having to talk to a claims adjuster who could be determining their care for the rest of their life based on injuries they received in service to the country, but while not active duty US soldier sailors. And so, having to navigate that while, they probably have better English than I do, because that's why they were chosen as a translator for us. But then, they're coming over here with their families and they've never had real health care. And now they're having to not only navigate healthcare, but they're having to navigate VA healthcare. like I mentioned, I've had healthcare my whole life. And when my ex-husband was discharged and given a disability rating, we were still fighting with just how to get his yearly physical done 5 years after he was discharged. And I'm savvy and I'm good at it. And so I can't even imagine that additional barrier of having a language and coming in from another country, possibly being on a temporary visa while you're trying to get permanent status. And so just it really, that military component just blows a hole in it, because it's not just native US born English speakers who are fighting with that VA healthcare system that is broken.
I completely agree, Megan, and it's not only those service members, those active duty members who are becoming veterans, and those translators who are coming over, who their role and function was essential in our ability to protect the people that were there, and to provide programs and services while we were there, everything from schools to education to hospitals, etc., clinics. I mean, it is amazing what they were able to contribute, and the translators were at the very, very point of the spear, the tip of the spear, in being able to make that communication happen. So yes, my perspective is more from a community member, and in that sense, I believe that everybody in our community has or should have the accessibility to healthcare, and should have at least the accessibility to information to determine if that is if that sort of healthcare that they choose to do or take is the proper healthcare. I know there's a lot of clinics out in town that are really based on that kind of profit margin and not necessarily focused on the betterment of the community. And so, I come from two perspectives, one from the military standpoint, but also from just a community member who sees it essential that we provide information and accessibility to those who, whether it be a communication barrier, a language, or whether it be a disability barrier, that they have that access to the same sort of services and programs that we have.
Hey, I'm sorry, because I'm taking notes too. So I want to make sure I got some of this. So my understanding from what Vic said and Megan is East County has a large number of translators, and perhaps there's some kind of link that needs to be developed to help enhance the VA benefit understanding and access, or perhaps that's even a need greater than just for the translator community out there, but in general in East County. Is that a somewhat of a good summary?
Yeah, and we have some really great SIV groups, which is I don't remember what the acronym stands for, but that's a lot of the translators fall into that group, and a lot of them are Afghans, Iranians, Iraqis, predominantly Arabic speakers, but they did help translate. And so as they're getting temporary visas to get out of their countries, which was a lot of times part of their kind of deal with their employment, was to be able to come over to the US and have a fast track to US citizenship for their service to the country. And that included medical benefits. But then once they get there, because of the language barriers, because of housing shortages, difficulties finding jobs, oftentimes their healthcare gets bumped down. And until they complete the process, and again, this is my understanding from working with one of the nonprofit groups, but until these nonprofit groups can connect them to a citizenship status or a permanent visa, they're not eligible to even apply for those VA benefits. And then once they do, the VA has very limited translation services and availability for written Arabic writing. And so if they need, if they speak English, they don't necessarily read and write the English. And so they may need Arabic written materials. And so sometimes that's the gap, is that they can't fill out the paperwork. They can't do all the forms that need to be done. And that's true of not just these translators who are coming into specifically El Cajon here in San Diego County, but that's true of anybody who's coming over, whether they're a refugee from Ghana, if they're coming over from Russia, from parts of Europe that aren't English speaking, is just having access to these healthcare providers and forms in a language that makes it accessible and easy for them to comprehend and understand, even if they are fluent in English.
Sorry, can I really
It
apologize
seems-
ahead? I don't know that I'm going to get this all right, so feel free to step in when I summarize.
Yeah, and Diana was supposed to, I think, just big picture stuff, kind of themes that come out of this, not the details. They're not, they're taking notes, more detailed notes. So when you said that, Megan, it strikes me that, I work for FEMA. So FEMA, of course, the federal government agency, has a lot of money, right? All of our taxpayer money, it has millions or billions of dollars that it puts together. And it goes into all these other communities when there's a disaster and needs to be able to communicate, and has evolved over time because of the very exact same problems that Megan's talked about, the need for translation into writing, as well as having interpreters to be able to speak. And so we've evolved and gotten pretty good at it, but we're billions of dollar organization. Now you're talking about trying to bring it down to a local community level. It's got to be primarily a funding issue. I mean, not even if there's a desire, there's someone that understands it like Megan, and someone that Megan's understanding is trying to spearhead some local efforts in East County. Where's the money going to come from? And so, trust, medium, money, there's all these things that are part of the mix.
Part of the other thing, and I think is if you can try to utilize systems that exist instead of having to create additional systems, and that can be very beneficial. So if you can identify existing systems, and this is because I studied social work for a while too. Really, everything's connected. So that's why I turned to the schools, because the schools have this identity in the community. There's a great deal of connection, but there are other things like that, like churches and things. So identifying, I think, existing systems that you might be able to utilize.
But then we have to
Diane.
circle back to the trust.
And you just transitioned into the next. So this, again, doesn't have to be linear, but another big picture is like thinking about those gaps, right? That's really important. And we're always going to need to identify the issue or the problem at hand. But then what resources do we have? So I'd love for us to kind of pivot a little bit and think about what resources are you aware of? Have you used with different organizations? Are you aware of within the community? Anything that people are using to really help to carry out your organizational goals or to address the gaps that we've been talking about? What's out there?
Grants. I was going to say, there's county organizations and county groups, even Health and Human Services Agency here in San Diego, that, this may fall under, and they may be able to fund. There's also Live Well San Diego, who's actually a department of them. And, I think that there are maybe some county resources, that there are maybe even state resources that could be tapped into, that could maybe cover the bill. And I don't know what that bill sort of looks like and what sort of campaign Megan has in mind and would be most effective. If it's a verbal, presentation sort of campaign that happens, every 2 weeks at, a certain facility that's donating their facility, well, then we're not really looking at a tremendous amount of overhead necessarily to present the information. But if we're looking at television, radio, and so forth, then we would need to look at some sort of sponsorship through maybe the county.
Well, and if we just look at the county too, and not necessarily with them as a funding source, but we look at what they already have. The county has phone translation services available through 211. And so having that as a resource, but, disseminating that out there, I think that's kind of what you were saying, Diane, is what's already out there that we can use. You can use these 211 translation services. I mean, I know I do pretty well with Google sitting at the front desk using my itty bitty bit of Spanish to get through a conversation with someone, but I absolutely could not do that with Arabic or, Chaldean's not a written language. We look into Russian, Polish, it's not going to happen. I can't use Google Translate for that. And so I have used the county before where I've had someone there and we pass the phone back and forth between a translator, and it is not fast, it is not easy, it is not perfect, but it is a resource that's there that I feel like is underutilized. And same thing, you know, with patient ombudsmans and patient advocates, HHSA, like you mentioned, Vic, you know, AIS and HHSA provide those. HHSA for the entire community. So that's going to include our undocumented individuals. That's going to include our recent immigrants, and AIS specifically for our over 65 population. And it is such a huge resource that people don't know exists. They call me and they're like, I don't understand what my doctor said. I don't understand what this bill I got is. I thought it was all covered. Have you talked to a patient advocate? Have you actually just called your insurance? And it's such this stigma because it's, you know, big pharma, big healthcare, big scary. And so we have to put these resources that, like the county particularly, I'm the biggest fan of the County of San Diego. They have so many things that we don't utilize, you know. And so how do we educate the population about those things that are there in our community? Like when Jack wanted to run a vaccine clinic, for example, this city is not a healthcare provider. We are not in the business of running vaccine clinics, but he was like, I want to partner with the county and with the Philippine Nurses Association, and we're going to make this happen. And suddenly the city was putting on a vaccine clinic. I think our first one, we did it in like 45 days. I mean, so, and it was because we had the support of these resources that, like as a recreation professional, I had no idea existed in the world. And now I know they're there and I can share them with people and I can hook them up with these groups and, you know, increase that access with money that's already been secured, experts that are already in their field, and I'm just pushing out their information. And so I think that's when that, like you said, you know, build that trust, let them know that it's a safe place to talk to, a person to talk to, and then have that person just, you know, if that's the PTA, great, have them push all that information out there. If it's them seeing the city of La Mesa as their home for 60 years, and so that's why they chose to go to our vaccine clinic, even though we have no business giving vaccines, but we can coordinate that event and they trusted us with that, great. Then that's the piece we need to do is, you know, take that communication, the resources and the trust and somehow figure out how to just, I'm all fired up now.
So Sarah, so I have a question, Sarah, with your project. I know you guys have been going for a couple of years, but you're also now moving out. So you're now gathering, hearing some things that sound like, hey, good ideas, or people are doing some things we didn't know about. And Megan's talking about leveraging what's there that, you know, once you find out. But in that same vein, what are you thinking about in terms of leveraging all the information, all these great ideas that you're coming to each of the various communities or organizations or whoever could move this step forward? And is this just here? Is this around the country? Is this?
So our grant, we actually are only in the second quarter of this grant.
Okay.
It's a 2-year grant.
Right.
But we are working to build infrastructure and systems that will hopefully outlast the grant. That being said, we're kind of, our 2 main objectives at this point are really to build a coalition of organizations and individuals within San Diego County that can do exactly what we're talking about with the resources and sharing that knowledge and sharing that information, where we bring experts to them to help build capacity within the community, within the organizations, but also that's a place where organizations can come to the table. In every single one of these community conversations, I've learned about a new resource within the county, within some nonprofit, within something. Right. And so we want to bring that together. So that's kind of one side. And then the other side is that we have just over $2.7 million in grant funding to disseminate. So one of our, this is financially the biggest part of this. The biggest part of the grant is that we're taking that money and we are going to be, we're going to have an RFA, we're going to have a call for program proposals, and then we are going to disseminate funds into the community, into organizations that are doing these things. And part of these conversations are to understand where we should prioritize that funding. So it's still very big picture in terms
So-
of the money right now.
So following up again on what Megan was talking about and the leveraging idea, you're working at least San Diego County wide and in the various communities and sharing information and resources, but just the translation, for example, into writing into Arabic or these other languages seems to me that's something that could be leveraged and then shared so that you're not duplicating the efforts and all the different ones that want to share information. You have things that are similar, and it could be one grant, but hey, you're doing it for the whole county, or you're doing it, and you will be available to share that resource or capability with other communities in San Diego County. Just another idea.
Absolutely.
So, sorry, I want to go back to things that we might have not have thought about or talked about, but maybe we have used senior centers. I'm trying to be like hard, detailed. You mentioned like the nonprofits, there's a variety of nonprofits. The high school district and the college district also have these extension classes. So like my kids, I did preschool through that, where the parent participates. So they have all kinds of things. You can do like a weekend thing. You can do they have these 1-day things. They have, a couple of weeks. So you can look into, I don't know if you could tap into that, but I was just thinking as you were talking, developing leaders within communities, that might be an interesting thing where you could help, because you want to develop these connections that people trust, and there are people who care who might be able to do some of this stuff. But if maybe there's a leadership thing for groups of people. Sorry, that's all. That's all for now.
I had
notes too, and I can't remember. So, okay.
Those are great comments, Diane. And I kind of wanted to just mention that, the process itself, it may be best to create the material as much as possible, working with folks in the community where obviously this is their specialty. I mean, we're working with folks who are translators and can really help us with understanding, or help this team or another team understand how to communicate what we're trying to communicate. And once those materials are sort of formed and materialized in physical form, it may be good to then begin to do the outreach. One thing I'll say is that I'm a co-champion at the San Diego Veterans Coalition, and it's very unique in our community that we have several different nonprofits, for-profit agencies, and in SDVC, we even have government agencies and educational facilities all coming together to better serve one community, and in our case, the veteran community. But we see community nonprofits working side by side for the betterment of this community, and I think that could also be the case here in this sort of effort. I think that by creating a network of different organizations that provide different sorts of resources versus trying to disseminate all the resources through one person may be more beneficial.
I definitely agree with that. And so I manage La Mesa's senior center. We're the adult enrichment center, but we're predominantly for older adults. And I have people who come in because they see us as subject matter experts, and they're asking about healthcare and all these different things. And we have so many great resources. We work with the VA. We actually have a County of San Diego Veterans Service rep who's at my facility in La Mesa every Friday.
Wow.
And it's great. But then, I also have Sharp Healthcare comes in and does free blood pressure screenings. And then Kaiser comes in and does fall prevention. And so I think, having those things available, but then also having just basic information, whenever it's Medicare enrollment, I have Medicare insurance reps coming out the woodwork saying, we want to talk about Medicare. We want to talk about Medicare, and I'm like, great, it can be educational. It's not a sales pitch. You can't sign anyone up for insurance at my facility, but tell them what to look for. Tell them what plan A versus K versus XYZ is. Do that. And so I think having those community points where we can disseminate that information, but then having resource guides that are a little more universal, it's hard because what I call my primary care, at Kaiser, I don't know if that's the same process to book through Sharp. I don't know if I know it's not the same to book through the VA or through UCSD. And so how do we find universal languages to describe the healthcare system so that when we're explaining it, it's not hyper specific to one person's situation and their healthcare provider?
Megan, that's hard. Because I also used to work in human resources and did benefits, and they all call them different things, and the rules are different for every, even you could be in Aetna, and every plan's different. So it's just, that's a hard thing to do, but I understand what you're saying. I just think about your seniors, the senior side of the thing. I called it the senior side, it's the adult enrichment, but even then, how do you communicate? A lot of what you said, I was like, well, you don't have to really be, a senior, because people think of seniors as being so senior. It's almost like trying to get people to recognize it as more than just a place for old people to go.
We're working on it. We're rebranding. We're going to become the Boomer Enrichment Center soon.
Oh, we don't have to, but just like, yeah, the enrichment center, and somehow make it, so getting that in what all the different services that you have, information, what a great resource. I didn't know all that stuff was there.
I've got a guide available on the city website you can download, but I think Sarah's trying to rein us in.
We have just over 5 minutes left, and I want to make sure that we get to this last piece. And you guys have touched on this a little bit, but I want to make sure that we think about it very concretely. What resources would you want access to in order to address these gaps, in order to further the resources that are there? I think some of the obvious ones we can skip over, like we want a giant bank account. That would be great. What else? What would we use that to have? What would we build there? If you could act, this is anything, what would you want?
To me, it would be translation resources. And I don't know how, but whether it's even teaching people how to utilize what's out there. But that would be huge.
That's what I was going to say as well, but things that can help me as a service provider in my community access those translation services. So I love it when I get an email for some program coming up and it's like flyer, PDF English, PDF Spanish, PDF Arabic, so that I know exactly what it is. And so if there's some type of information or seminars that are done, if things are disseminated, that there's some type of landing page, if it is online. I'm a big fan of the print media because of the demographic I work with, but I know that it's expensive. It's hard to keep up to date. So if it is a website, making sure that it's out there in a way that the, helpful white girl in La Mesa can access this stuff to give it to the community members who don't speak English, who are struggling with this. And that's not going to make me be embarrassed to be like, what, I don't know. I can't, well, I found this flyer when I searched, Kaiser doctor's appointment Arabic, but I have no idea what's on it. So, having it in a way that it's, okay, this is the English version, so I know what it is, but then it is available in Mandarin, English, Spanish, Arabic, so that I can help them without speaking that language.
So and when Megan was talking about, we have a system, we do not have universal health care. We can't go like Canada to OHIP and just go to one source and have somebody explain it. That's not going to happen in our country in any, but having someone to go to be able to talk about how to navigate whatever healthcare system an individual has access to. And even to have a discussion with them about what healthcare access do they have that they may not know that they have. Having some resources where individuals through these other media, and we're telling them, here's a way you can do it, but having almost a single place that they can go to, that they can ask questions about, well, I have this going on, or I need this, or I think my mother needs this, or my husband or my grandmother needs this. And then just having not someone, but some people that are versed enough to be able to say, here's how to try to help them navigate whatever it is. And 211 is great, but they're not versed in this particular area of healthcare, and having a source, even that they or anyone else could say, call this number, go here, and they will help you figure out how to navigate your particular, at least get you started to the right source to help you navigate your particular area that you could get access to.
I'm going to call that navigating health issues, right? You meant
Yeah, the
specific
super
health?
navigator, the ombuds for all systems or something.
Okay, yeah.
Well, but then you just used a term, Dennis, ombudsman, the ombuds for all. People don't even know what a healthcare ombudsman is. They don't.
I know.
Like
No,
when
I
they're
know, I
talking
get it.
about,
So you need
know-
a better name. You need a better name. And then the resources could also all have this, whatever our media and our resources could say.
Yeah,
Here's
I
the
tell
way.
people to talk to their patient advocacy rep through their healthcare or through their mom's retirement community or whatever it was. And
Yeah.
they, like, their mind is blown that
No,
there's
that's what I
somebody
mean.
in
That's
the
why
field. Yeah.
so you need someone that's just someone in the county. And this is it. This is the person you go, and then they'll get you to those other people. Here's your ad. I'll help you find your advocate or the place you go to in Sharp or Kaiser or the Veteran Affairs or, your particular, provider. And they have that access, but you only have to call one person who can speak to you about it. Anyway, it's a thought.
If I could
So-
throw in one thing, Sarah, towards the
Yes.
end, is information and data. With the COVID vaccination and incidences of people coming down with COVID and getting ill, the county health department was gathering data, but there was a bit slow in getting it to us. So we suspected there were disparities within our community, but it was hard to identify those disparities. So I think, like with any other social issue, healthcare, information is very important. And as we have more specific information as to where the disparity is, then we're better able to direct resources to see what the problem really is and see what is the limiting factor in breaking through. And if it is language, then we could address that. If it is something else, if it is, in La Mesa, there's different parts of La Mesa, and people would say Sharp Hospital is where our center is for vaccination. There are so many barriers to that. Some are physical, some are cultural, some are language, some are so many. So even though that may be the center to get vaccinated, we were still seeing huge disparities in terms of who were getting vaccinated. And the healthcare center system knows that there are disparities, but for a variety of institutional issues, they can't always break through. They tried. So I think data and getting that data to policymakers will be helpful, as well as your grantees and grantors.
Jack, thank you. I think you're absolutely right. I'm glad that we had the time to get that in. We are being called back to the main room. So Diane, we'll look forward to you sharing there. We'll have everybody share for just
Wish
a
me
minute
luck.
or two. You're gonna do great. It's gonna be fantastic. It'll be great. I'll see you all there. Welcome back. We're gonna give everybody a minute or two to hop back on. I hope that everyone's conversation was as robust as ours was. I don't want to say you should be jealous you weren't in our room, but maybe you should.
They should be jealous they weren't in our room.
Right? Okay.
Actually, the first one was speech.
Hey, I'm gonna ask if everybody
And
will
this
go ahead
one I
and
did
mute themselves. As we are, oops, I also unvideoed myself. All right. Well, thank you all so much, first of all, for sharing your thoughts and your input. I know that in my group that there were really great conversations, and I want to really acknowledge the fact that every time we come to the table, especially with people that we don't know, that sharing this information, sharing our own experiences can be very vulnerable. So I thank you all for being here, for being vulnerable with us. I think that vulnerability is one of the biggest gifts that we can give each other. And I think that we absolutely cannot move forward in this work with advancing health literacy without it. So thank you, thank you, thank you. I would love to take, it's 7:12. I want to take the next 10 or 12 minutes and just give every group 2 or 3 minutes to share some high level pieces, maybe some themes that came up in their discussions. So is there anybody who would like to go first?
I'll go first so I could be forgotten.
Go ahead, Diane.
Okay, so let's see. The first question was about disparities and gaps that need to be addressed. And we discussed it extensively, language barriers, both written and verbal, oral, actually, I should say, written and oral, specifically, particularly for Spanish and Arabic in our area, but others as well. Access to the internet, developing trust in communities, identifying trustworthy persons that different types of groups might feel comfortable having faith in, and developing communication channels for information appropriate for different specific groups. That's it, I think. No, there's a little more. Addressing mental health challenges and recognizing that East County has the largest number of translators that were supporting the US in the Middle East. And there's a lot of complications with how they're learning how to access the resources that they are supposed to be able to get. Done.
Beautiful. Thank you, Diane. Who else would like to share?
I can share for our group. So some of the gaps that our group brought up included doing outreach to older adults, especially navigating the sort of the digital divide. Transportation was one gap that was brought up, as well as for doing effective outreach to diverse communities, knowing how to reach people where they're at. And then we also talked about some of the challenges were finding funding and financial resources to do outreach, reaching out to community-based organizations to sort of do the work in communities. Let's see. And also, you know, sort of the challenge of working in silos is something that our group sort of mentioned is something that we'd like to address. And let's see what else we have here. Resources that have been used included reaching out to leaders in the communities, working with community health workers and promotoras to be doing outreach, and just finding extra hands to be, you know, on deck when we're doing this sort of work and doing outreach and researching around you know, this sort of landscape. Anything that my group members would like to add to any of that? Nope.
I guess I will speak for our group. You know, one of the things that we focused in our group is that, and we don't mean to be facetious in this, we have to make these meetings a little more sexy. We got to get people more involved. If we can't get people involved, we'll have 18 people trying to solve the city's problem. Can't do that. So we know we have a lot of causes. We know we have a lot of things that we need to do, but you gotta have more input from the community. So how do we get more people involved? And I do think the city does a good job of Facebook. There are different venues, communities, in the newspaper, on the internet, and all that good stuff. But there's a big part of our community that don't use those kind of resources. So, I mean, I don't know the answer, but just there should be more people on this call, and there should be more input of what we're doing. Those breakout groups should have been 20 across the board, and the input should have been great. So how do we make it more sexy for people to come in, join, and participate? Not just listen, but participate and have fun and get that stuff done. So I think that is a huge element, regardless of what organization we're going to try to help or which group we're going to try to help. We got to get people involved. So that's what we talked about.
That's so important. And Alan, I'm glad you brought that up because there are so many aspects of this program that we really wanted to focus our time today on the discussion. But I want to take a few minutes. We have a few minutes now, and I want to make sure that we bring up a few of these things with you so that you all know that we do have pieces of this program where we are going to be going into our community, and we're going into not just our community, into communities across the board, across San Diego, communities that are underserved, and say, you know, we want to hear from you. We want to know what it is that you see. What is your experience? We understand what the data says. We understand what, you know, the narrative has been, but what is your experience? So one of the aspects of our program is using a platform called Streetwise, and it's meant to do just that, essentially map out issues and resources that community members see. We also are building essentially a capacity building seminar series where organizations and individuals in the community will be able to come to all of these different learning opportunities where they can understand more about why do we collect data? Why is that data important? How do we use that? How does an organization use that? And you're right. I don't know that it will ever be sexy necessarily, but interesting, right? And engaging. And we want it to draw them in. So I'm glad you brought that up because I think that is something we need to consider for sure. And then, you know, ultimately the biggest financial piece of this grant, because it's a big grant, is $2.7 million of grant funding will be funneled back into communities and into organizations to make changes, to build out programs to address the things that you all are talking about, to address the gaps and to build on those resources. So those are all really important and key components of the program as a whole. But long term, when we think about what advancing health literacy is, it's not just in this time of COVID. It's not just in this one community. It is, how do we build this program in a way that we can be supporting and sustaining all communities and those resources that we've been talking about. Reem, is there anything else you want to share about the program itself? Asma, I want to pause there, and then I want to make sure that we do have some time for questions from the community and from everyone here tonight.
I think you really explained that very well. Thank you, Sarah. I would just say that we will be sending out sort of a coalition interest form, just basically asking if you would like to stay involved in the Advancing Health Literacy program, and just getting some information from that from your organization. And you can keep an eye out for that. We'll be coming soon. But we'd love to, if you have any questions that we can answer, anything about the program in general or about the discussion groups that we just had.
I don't know if this is a question, but following up on what Alan said and going back to one of the things we talked about, I think I shortchanged our notes. But anyways, we had talked about, how to get information to the people, and one of the things we didn't talk about, but when Alan mentioned it, is town halls. And I really believe town halls at schools. And I've been to, I don't know if you guys know Susan Davis, but Susan Davis was our rep. And she did town halls and she did them in multiple locations. And she drew so many people. She's like, I'm the biggest Susan Davis fan there is. So I don't know if that's true, but she's just really phenomenal because she would bring in experts and people could ask questions of those experts. And they didn't have to ask questions. You could just sit there and listen. But they did it in places where people could feel comfortable because it was there, you know, it was an open space. It was, so just a thought.
Right, and I think that's a really important thing that came up in our discussion as well, is just sort of being where people are, meeting people where they're at. I think that's a really great way to get engagement.
If you haven't seen it in the chat, I just said, if you'd like to continue to get updates from our program and continue to be involved, then please do drop your email in the chat. We would love to continue to keep you updated, and Asma just dropped our emails. Thank you so much. I was about to do that. She reads my mind. And if you have any questions for Reem or myself, you know, please do reach out to us. This is a program that we very firmly believe is built by the community, and we are here to facilitate that building process. So if you have thoughts, ideas, if the questions or the discussion that you had really brought things to mind that kind of continue to percolate, we'd love to have a conversation with you. You're welcome to share that by email, whatever that looks like. Or if you are thinking, oh my goodness, this person should be at the table, then please, we would love for you to connect us to whoever it is, because fortunately or unfortunately, we will never know all of those people. And we are really relying on you to help us learn who those people are, learn what organizations are out there doing the good work, and to build on this momentum and, you know, to make it interesting, engaging, maybe one day sexy. I don't know. Alan, we're just gonna run with it. It's gonna be great. We're gonna, that'll be your chair. We'll let you chair that subcommittee. It'll be good. But well, I am never a fan of keeping people on any longer than we need to be. And I feel like this was a really great conversation. Reem and Asma and Ruth and I will hang on for a few more minutes. If anybody would like to share anything or chat with us about anything, we'd be more than happy to talk with you. But with that, I will say thank you. Thank you so much for giving us 90 minutes of your evening. We really appreciate it. And Sue, extra special thanks to you and to Meg and Terry for all of your assistance in setting this up. And we hope you have a great evening.
Yes, thanks so much, Sarah and Reem, for bringing this to us.
Thank you so much.
Thanks.
It was good to meet you, Dennis.
Thanks everyone for participating.
Thanks, Sarah.
Thanks.
Appreciate
Bye,
it.
Ellen. Have a good
Bye,
one.
everybody. Thank you. Megan, Cosmo, Ruth, Nancy, Don, Dennis, Megan,
Hi, everybody.
Doug, Jack,
I'm
Harry.
hanging on for a
Bye.
second.
Okay.
You guys have a good night. Take care.
Have a good one.
You
too.
I feel bad because I did, Sarah knows there were more. I thought you were just doing the first section, but we have I have more notes that we didn't even talk about. So should I send them to you or?
If you
Or
have
mention
them, we always, that would be great. You know, I took notes and we have a recording, but if you already have them written out, then I'm never going to say no to that. Feel free to, my email, the shvicente@health.ucsd.edu is in the chat. And even if you wrote it out by hand and you want to take a picture of it and screenshot it, that would.
No, I'll type it up.
I thought there was a lot of great ideas, you know, coming from Meg and Vic and Diane and you know, I had a couple of throw in there as well. And then I thought there was a lot of really good things in there about, you know, obviously the communication and trust, which you're going to hear from everybody, you know, who is communicating and who they trust and how it's being communicated, and translation, all that'll be repeated over and over and over. But you know, some of the other ideas I thought were maybe unique and enough that maybe there's some nuggets here and there you can grab from each of these communities you go from. And for me, it was that last one about, the one-stop shop of, calling somebody, you need to call somebody in Kaiser or the Sharp or Veterans or whatever. But if you had one person or one place to call that could then steer you to, how to access what you may have the ability to access, that either you don't know or you have something, but you don't know how to navigate it. If there could be a resource in San Diego County that somehow you could communicate in the ways that we talked about with trusted people through the mediums that they use, that they trust, that to me could go a long way to access, to the idea of access and people actually utilizing what they may already have. And if they don't have it, maybe that person or those persons, simultaneously or otherwise also could share, here's what we have here, if they're refugees or immigrants, for example, what kinds of healthcare options are there that you can purchase, or if you don't have enough money that you have access to, there's that is, I'm guessing, a big lack. And probably the other biggest one is the trust and communication of what is there. Those are the biggest hurdles, the trust and communication. But then after that, where do I go? Okay, now I hear it, I trust it. Where do I go to actually take the next step to learn more about how I can use this for myself and my family?
Yep, absolutely, Dennis.
Thanks, everybody. You too.
Take
Bye-bye.
it from here. Thank you so much.
Thanks. Bye-bye.
Well, Diane, we are here if you have anything else, or Misty.
The only thing is, I just texted you, is I didn't see your email address. I was SH Vicente.
Yes, I will. You know what? I'll send you an email right now. That way you can just hit reply.
Okay. All right. Thank you.
Thank you so much for your
Everybody.
time, Diane, and much
Yeah, no
appreciating you sharing out for us.
Yeah, no problem. All right. Talk to you. Thanks. Bye-bye.
Have a great evening.
All your work.
Bye.
Bye.
All right, everybody. Thank you so much. Have a lovely evening, and we'll talk tomorrow. Unless anybody has anything specific here. Let me